What to expect in the final stages of heart failure. 13 signs and symptoms of dying. Hi, it's Katie Duncan here with Death Care Coach, where we help you better navigate the end of life process. Getting a diagnosis of heart failure is really serious news. At the time of this recording, it's estimated that over 6 million people are living with heart failure in the United States alone, and it's the cause of about 400 deaths per year. Now, most people don't know what to expect when someone with heart failure reaches the final or really end stages of the disease. Nor do most people know what signs and symptoms to expect when someone is dying of heart failure. So, in this video, we will talk about the terminal stages of heart failure, that final or end stage, and the 13 signs and symptoms to look out for when a person is dying of end stage heart failure. Make sure to stick around to the end of this video because at the end, I'll also give you an approximate timeline to death for a person with end stage heart failure who is also on hospice care. Now, before we get into those 13 signs of dying from heart failure, it's important to really know what heart failure means and what's happening to the heart and what's happening to the body when someone has heart failure. So, what is heart failure? Heart failure is a slow and ongoing weakening of the heart. So as the heart slowly gets weaker, it doesn't allow the heart to pump blood through the body as it normally would. So over time, this causes other damage to the body since now blood isn't able to reach the organs and the tissues as well. Now, at first, the heart tries to sort of compensate, or it sort of makes up for the weakness by changing in different ways. So, for example, the heart might stretch, or it might get bigger, or it might even pump faster. The body also tries to adapt and change and sort of compensate. So blood vessels get smaller or they get narrower, and it starts to reroute blood to certain organs. Because of the way the heart and body try to compensate, many people aren't even aware that they have a problem during the earlier stages of heart failure. Now, despite the body sort of adjusting and compensating and adapting, heart failure will continue to worsen, and the body won't be able to make up for the lack of blood flow at some point in time. And at that point, the person with heart failure may start to experience different symptoms, things like fatigue and weakness and breathing problems and other issues. There are many different treatments that can help people manage their symptoms and really slow the progression or the worsening of the heart failure. However, heart failure is what we call a chronic condition. This means that there's no cure and that the disease progresses or gets worse in time, even with ongoing treatments. Over time, some people will reach the final stages of heart failure, and it's at this time that a person is really considered appropriate for hospice or end-of-life care and support. By the way, if this video has been helpful so far, I would be so appreciative if you could just hit that like and subscribe button below. This helps my channel grow and it helps it be found by other people who are going through similar situations. Okay, now that we have a better understanding of heart failure and what's actually happening to the heart and to the body, let's go ahead and take a look at the 13 signs and symptoms of a person dying of heart failure, really who is at the end of life. So number 1, shortness of breath. This is also called dyspnea. In the final stages of heart failure, people usually feel breathless, both during activity and when they're also just at rest. They're not doing anything. They can feel short of breath. This is usually caused by fluid that starts to get backed up into the lungs when the heart isn't able to pump blood properly anymore. Number 2, anxiety. The person with heart failure who is short of breath may also experience anxiety. Feeling like you are not able to catch your breath can be sort of anxiety producing, and then that anxiety can cause someone to feel more short of breath, and the cycle can then continue. Number 3, coughing. Coughing is often associated with shortness of breath and that fluid that starts to back up in the lungs. You might also notice that coughing is worse at night or when the person is lying down. The person with heart failure might also cough up mucus that is either white or maybe even pink. Number 4, wheezing. This also goes along with things like shortness of breath and coughing and fluid in or around the lungs. Remember, there are many different treatments to help relieve all of these symptoms, so always talk to the healthcare provider if any of these have become a problem. Number 5, weight gain. Weight gain is usually caused by swelling, which we also call edema. Because the heart can't pump very well, fluid oftentimes builds up in the body, and this causes swelling. So, the person with heart failure might have swelling in the feet, or the ankles and the legs, the hands, the arms, the belly, or maybe even the veins of the neck. Number 6, tiredness. The person with heart failure will likely sleep more and more. They might take longer and more frequent naps during the day, and they may sleep really late into the morning. Eventually, the person with heart failure may be sleeping all the time, 24 hours a day. Number 7, weakness. The person with heart failure will not be able to manage activities like they once did. Even their most basic needs, things like repositioning themselves in a chair or even the bed, feeding themselves, everything will become more and more difficult. They might start falling, and at some point, they might not even be able to get out of bed anymore at all. They will really need someone to care for them at all times. By the way, if this video has been helpful so far, I would be so grateful if you could just hit that like and subscribe button below. This helps my channel grow, and it helps this information get found by people who are going through this situation and this journey. Number 8, decreased appetite. The person with heart failure will lose their appetite. They likely won't eat very much, and they'll probably get to a point where they really don't want to eat at all. This is also a natural part of the dying process. As the body is shutting down, so is the need and desire for food. Food is just no longer the body's priority. It's shutting down. Number 9, nausea. This can often really go along with that decreased appetite and that swelling or sort of bloating in the abdomen. It's also normal and natural for the digestive tract to slow down at this time. Number 10, urination problems. So you might notice that the person with heart failure has things like urinary incontinence, or they might even need to urinate at night a lot. Urinary incontinence is when a person leaks urine on accident, either because they are just unaware that they need to urinate, or they just aren't able to get to the toilet. Both incontinence and nighttime urination could be happening for many different reasons. It could be linked to the use of certain medications, such as diuretics, which help the body get rid of excess fluid that it's holding on to, and this causes someone to urinate or pee a lot. It could also be due to overall fatigue and tiredness and other daytime symptoms. Number 11, increased heart rate. The person with heart failure may even be able to feel like their heart is actually racing. Number 12, chest pain. The person with heart failure may be able to feel like their heart is throbbing, and they might even report that they have chest pain with activity and even at rest as well. And finally, number 13, thinking difficulties. As heart failure gets worse, a person becomes confused. They have things like memory problems, and they might even just seem really disoriented and out of place. This is often due to really a combination of factors, things like decreased blood flow to the brain when the heart isn't pumping very well anymore, decreased oxygenation levels throughout the blood and the body, and as the body continues to shut down, toxins can also build up in the bloodstream, and this can also cause confusion. If you are noticing most or all of these signs, and the person with heart failure is not yet on hospice, ask the healthcare provider about a hospice consultation. It's important to realize that not everyone in these end stages of heart failure will experience all of these symptoms when they are dying, but it is likely that they'll experience most of them. In this terminal stage of heart failure, the severity of these symptoms might also fluctuate from day to day and even from hour to hour. Okay, so earlier I mentioned that I would give you an approximate timeline to death for a person in the final stage of heart failure. So let's go ahead and talk about that now. The average life expectancy for someone diagnosed with end-stage heart failure is less than 1 year. Of course, every person with heart failure is different. There are other factors that are always going to be involved. So, for example, does the person with heart failure have any other diseases or illnesses? So, things such as lung disease, kidney disease, cancer, any others? How difficult have their symptoms been? And how hard has it been to really treat and manage those symptoms and get that person comfortable? How poor has their appetite been? and many other things like that. But generally speaking, if you are noticing most or all of the signs and symptoms that we talked about here, and the person with heart failure is continuing to decline physically despite the maximum amount of treatments, the person with heart failure likely has less than a year left to live, and they may even have as little as weeks to months. If you found this video helpful, please hit that like and subscribe button below. Again, this is more valuable than you can ever know. And if you have questions, leave them in the comments below. All of these things really help people like you and help people who are going through this journey find this information. Thanks so much, and be sure to check out my other videos on end-of-life care and the dying process on our channel, Death Care Coach. See you soon.